So once again, welcome everyone to tonight or today's webinar on COVID-19. We'll be starting in a couple of minutes. Please stay online. All right, everyone, according to my clock, it is 8:30, so I guess we will start the webinar. So again, welcome all. If you have joined 2 minutes ago or joined just now, welcome you all. This is probably the first webinar that's organized by SDSN Hong Kong, which we'll try to explain a little bit what SDSN Hong Kong is. But please, first of all, join me in welcoming the two other very distinguished panelists. So Professor Gabriel Leung from the University of Hong Kong, and also Professor Samuel Wong from the Chinese University of Hong Kong. I won't go into detail in explaining what they have done because that would take the whole webinar to do so. But these two very distinguished public health experts, I think tonight we will try to explore COVID-19, the challenge itself, from where it came from and where it's going, and then also from both public health, epidemiology perspective, and also from a psychosocial perspective. So before we start the whole webinar, perhaps if I may take the opportunity to just give you some context. All right. So the United Nations Sustainable Development Solutions Network, or in short form UN SDSN, it was set up back in 2012. It was set up to try to address the SDG 17. So there are 17 Sustainable Development Goals. And then it is primarily formed, in different nations, different regions, but primarily it is for knowledge sharing. And I think the members together try to build solutions around the SDGs. Now, back in 2018, the Hong Kong Jockey Club Charity Trust, we were invited to initiate the chapter in Hong Kong. So which we did together with the Chinese University of Hong Kong. So currently myself, I'm the executive director of the Hong Kong Jockey Club on charities and community, and also the vice chancellor of Chinese University of Hong Kong, Professor Rocky Duan. So we co-chair this Hong Kong chapter together. So, this is in fact the first webinar that we organize. And tonight we have roughly about 600 people registered for this webinar from around the world. So I guess if we were to talk about COVID-19, by now we all understand it is a global humanitarian challenge. And if we were to look sort of beyond Hong Kong, of course, Hong Kong, I think we are seeing a fairly positive trend, especially in the last couple of weeks. But, all around the world, there are countries, regions, they're on different curve, both in terms of timing and also in terms of slope. So the challenge is still very much with us today. And then if we look in a little bit more granular level, then what we found is also that, among those affected, is disproportionately with certain more vulnerable groups, like the elderly or like those with more chronic health conditions. But in the meantime, also within certain socioeconomic classes, they also reflected quite differently, in being affected by this particular challenge. Now, every government practically now goes on with some sort of mitigation measures, including social distancing. But of course, while in some places it proved to be extremely effective, I think Hong Kong probably is being one of the examples. But a long period of time of social distancing does also bring along other challenges, on jobs, on emotional side, and also on for a lot of the chronic disease patients, for example, there's difficulties now in accessing medical or social services. So all these things we have to take also into consideration, when we think about the overall impact as a whole. So how do we think about sort of addressing panic, bring about hope? I think, again, if you look at different players, different actors in the community, from the government to business to healthcare professionals, also on the community side, the civil society side, everyone can bring to the table their perspectives, but also their contributions in fighting COVID-19. So we won't go into detail in all the things that everyone does. I just want to bring to you sort of one slide on perspectives from philanthropists. So in Hong Kong anyway, what have we learned from SARS 17 years ago? And what are we doing today with those kind of learning? I think back 17 years ago, SARS hit Hong Kong. It was, we were extremely unprepared as a society at the time. And I would dare to say philanthropists at that time also, did not find time or ways to really quickly react to the challenge at the moment. Of course, afterwards, I think many people then subsequently did many different things, which I'll go into maybe in later part of this whole discussion. But I think this time around, people are a lot more responsive to the challenge. So if we were to take the Hong Kong Jockey Club Charities Trust as an example, during this whole crisis, I think we believe in 3 words and really try to put those 3 words into practice. So agility, empowerment, and also creativity. In agility, I think, again, sometimes in situations like that, in a disaster situation, relief needs to come with speed. And speed sometimes is even more important than perfection. Right? So for us, we quickly put together a few relief package, and quickly get the money into the communities and buying the communities close to 15 million masks, various types of disinfectants, and also including some daily items like food that people need, particularly the vulnerable groups like ethnic minorities and etc. I think the second thing is about empowerment, because money doesn't do the work. Right? It is the organization, it is the people on the ground who can then deliver the service and do the work. So to us, very, very importantly, when the crisis first hit Hong Kong in February, we very quickly call all of our partners, so our grantees. There are over 400 of them. So we ask them, everyone, all of them, what they need, and we try to be flexible in the grant making that we have with them. In the meantime, we also set up an emergency relief fund, which is 100 million Hong Kong dollars, so about 13 million US dollar. Now, the critical thing is, on this particular fund, the whole grant application process is digitized and also simplified. So we were able to meet most of the grant requests within 2 weeks, from initial requests to money in the NGO's bank, so that they can go out and do the work for the very specific vulnerable groups that they help. So in about 8 weeks' time, we distributed already 85% of that 100 million. These are money in the community's hand. So empowering these sometimes very grassroots organizations to also react very, very quickly and very specifically to the problem is very, very important. Now, last but not least, I would say, creativity is also very important. Again, it's beyond money. It is also to think about, what else is required. So I suppose not just in Hong Kong, but also in other locations, a lot of the schools are closed. So students, they need to stay home and learn from home. But then when you really look into the student population, sometimes a lot of the grassroots students, they don't have broadband at home. There is no reliable Wi-Fi. And then the parents or their own cell phone's data plan is very limited. In the past, when they go to school, that's probably sufficient. But then now, they go on webinars, they go on any kind of online resources. The data plan dries up very quickly. So what we did also about a month ago, we talked to all 4 mobile carriers in Hong Kong. We got them to offer different packages at cost. And then we supported basically over 100,000 free data plan cards. So 30 gigs a month, that would be sufficient for their online learning requirement. So we gave out 100,000 these free data plan to support 100,000 students to really be able to learn from home. So these are all, I think, just an example on how philanthropists or business or foundations, what we can do in terms of reacting to the current challenge. But of course, there's always still a question sort of in our mind, is that, we are doing what we can, reacting to the situation. I think in a lot of people's mind is still sort of why and how this happened. And then versus SARS 17 years ago, have we done any better, from sort of infectious disease control perspective? So, so this question I'll leave to maybe have Professor Gabriel Leung to start us off with those 2 questions. Gabriel.
Thank you very much indeed, Leong. And may I be allowed to share my screen?
Please.
There we go. Yes. So I'd just like to perhaps spend 5-10 minutes very quickly going through the outbreak in Hong Kong so far. So this really sort of summarizes the epidemic curve, so-called, which is essentially the number of cases plotted by the date of illness onset. So as you can see, we've had 1, 2, and 3 phases of importation. The first phase, for the latter part of January, were mostly, in fact, exclusively from mainland China, including, of course, at the original epicenter of the outbreak in Hubei province. This initial cluster seeded quite a few local cases, which are shaded in the lighter color here. And then that was quite well contained until this second, much smaller but significant phase of importation, which were mostly returning tourists on board the cruise liner Diamond Princess. Then we've had, over the last month to month and a half, a very large third importation phase, consisting mostly of Hong Kong students who have been studying overseas, mostly in Europe and North America. And of course, this is because in those parts of the world, this is where the epicenters have been during the exact same period. Now, but as you can see, we've not really had much of a sustained local outbreak, so the lighter shade colors. And this is mostly due to these 3 very important sets of measures that the government, the public health authorities, and quite importantly, the Hong Kong people themselves having done together. So the emergency response level was activated actually on the Lunar New Year day on the 25th of January. And since then, the border restrictions have been progressively implemented starting from the original epicenter of mainland China, then South Korea, then Iran and northern Italy, then other places in Europe, including France and Germany, Japan, Spain, then the whole of Schengen, and then Macau, Taiwan, and really the entire rest of the world. Then you have a second set of measures, which are mostly so-called case-based, and this is basically quarantining of close contacts and isolation of infected individuals. Now, this started again from the middle of January on and progressively layered on such that there is now very, very good universal screening of all inbound air passengers and testing before they go on a 14-day compulsory quarantine. Then finally, community measures, and these would be inclusive of school suspensions, as well as the closing down of theme parks, cinemas, other leisure venues, karaoke, nightclubs, bars, and then restriction in restaurant capacity, and of course, the congregation of no more than 4 persons. So these measures are the 3 main control knobs that government has at its disposal generically, and they can and should be tuned for looking at the effective reproductive number curve, that is the famous RT curve. And as you can see, Hong Kong really, except for the very first period where RT approached R0, which is the basic reproductive number of around 2-ish, it has actually come right down, mostly below this particular place of the threshold of 1. And then it has been dancing up and down just around 1 until the very, very bottom here, and it's hovering around 0.3, all right? Then, as you can see, we're now looking at the influenza sentinel surveillance work. And the influenza sentinel surveillance work basically shows for this year, which is 2019-2020, it's been actually interrupted mostly by the COVID-19 measures, quite unlike in 2010, 11, and 2014, 15. Now, I should like to perhaps now highlight that it is important to hold the disease prevalence for a very long while under a low disease prevalence scenario. Because if you allow it to grow and that it expands to above 1, it can go back up to this high level, even though RT is at 1, you are looking at a very, very high daily disease prevalence, which would take you an inordinate amount of effort to press down way below 1 for a very prolonged period of time so that you can get back to this pre-epidemic level. So it is very important that we do not prematurely relax our measures in terms of the physical distancing and the quarantine and isolation. This is a blog, a web blog of Tim Gowers, who is a Fields medalist at the University of Cambridge. He's a pure mathematician, that's why he's a Fields medalist, but he has done a whole series of very clear explanation to basically have come to the conclusion that we should do the suppression and lift measures, but we should do them in such a way that they should be low threshold triggers, and you should switch between them quite frequently so that you can maintain at a very low level of infection. And this is what Tom Pueyo has called the dance. That is, you dance just above and below the threshold of 1, such that you actually would be able to control it rather than allow it to grow unmitigated. Finally, I'd just like to point out that we are going to be in this uncomfortable 3-way tension between health protection, economic preservation, and social consent and emotional well-being. That is really the key to realize that it's not just about looking at the public health aspects, because we have, number one, even within the health sphere, we need to look at other important health outcomes, such as the so-called more discretionary or non-urgent cases that have been cancelled or postponed as a result of the COVID-19 measures, but also looking at jobs and the economy and livelihood, as well as people's emotional well-being of actually complying with some of these very drastic measures in terms of physical distancing. Finally, I should just like to add that the tech enablement, which of course the Charities Trust is also very good at in funding and supporting. For quarantine and isolation, I think testing and really trying to scale the private sector by creating both a private market of demand and supply and beyond the public sector capacity is very important. We are looking at something like 10x of current capacity, which is quite important. And then semi-automated tracing, because the contact tracing infrastructure we have currently is probably not fit for purpose for such a huge pandemic of this scale. And then finally, of course, we've been using wristbands that's Bluetooth enabled and tied to your mobile phone for the home quarantine orders. Now, there have been many iterations, and I think now the government measures are now quite mature, and it's something that I think we need to do more on. For the physical distancing, looking at macro level at the whole population, looking at Octopus data, which is our ubiquitous payment card system, or mobile phone location-based mobility and mixing data, that's also something that not only Hong Kong, but other places should and have been looking at. And finally, about vaccination. We need to have security of access, if and when they have become available, as well as very good post-marketing or so-called phase 4 surveillance for safety and side effect profiles. I think I'll limit my comments to those and very happy to discuss and learn from the audience. Thank you.
Right, thank you. Thank you, Gabriel. It's a very thorough understanding. And I really look very hard into the charts to try to understand, some of the finer details. But I guess I would need to take an offline separate class with you to understand all the details. But you mentioned this three-way tug of war. I think it's very interesting because when I think back in SARS, I don't remember a lot of people talking about, particularly on the social emotional side. But this time, I think a lot more people start to realize mental health is part of the health. It's not a separate thing from the physical health. So perhaps on that note, maybe we have Professor Samuel Wong to share with us, how sort of you look at the COVID-19 challenge from a psychosocial perspective. Samuel, please unmute first.
Yeah, thank you very much. So if you allow me to share the screen.
Please.
So I'm just going to show everyone where Hong Kong is with respect to other countries, especially places around us. Before I talk about some of the risk perception of the community, which may actually contributed to one of the reasons why, as Professor Leung have said, that has contributed to the relatively well control of the epidemic in Hong Kong. So there was a survey conducted within 36 hours of the first diagnosed case in Hong Kong, looking into not only the mental health related issues, but also whether people think that they're at risk for having the COVID-19. Interestingly, Hong Kong people in general are thinking that they have a high perceived susceptibility. And also when they are being infected, they think that the consequences of that is quite severe. Now this is actually a good question that I want to ask is whether this perceived susceptibility actually has related to healthcare preventive behaviors that might help people to take more precautions. And that's whether these same questions, if we ask in different countries, will have different results. So one of the things about the perceptions of COVID-19 outbreak from the community is that the majority of Hong Kong people are actually quite worried. But they worry in a very good way. Why would I say that? Because most of them are not clinically anxious, but they are worried in a sense that they achieve a borderline level of anxiety. Now, this is, you can actually compare this to the anxiety levels during the SARS epidemic. In fact, that paper was previously done by Professor Leung in 2005. It's showing that the anxiety level this time is actually significantly higher compared to before. And there is an increasing time trend in anxiety and depression from the community as measured by the anxiety and depression scale, showing that the more cases we have, the more anxiety there are in the community. But the questions we have is that, well, how does that relate to some of the protective measures? And in fact, similar surveys is done in the UK, which I didn't show it here, showing that people might have reduced anxiety level when compared to Hong Kong, but less preventive measures are being taken when there is decreased levels of anxiety, which means that sometimes some sort of anxiety is actually a good thing, and does not necessarily means that it's something that we should avoid. Now the questions become, when do we have to worry about it, and what kind of information in terms of communication risk strategies we need to think about when we are providing information for the general public. Hong Kong also has a very interesting response in this aspect. When you look into the information reliability and the access to information of COVID-19, surprisingly, if you compare that to some of the UK studies and overseas, showing that a lot of people actually do not rely on the official websites, which pose some question for some of the NGOs and the other stakeholders in this time that might play a bigger role, including the social media, key opinion leaders, and also other leaders which might be influential in terms of providing information for the general public. So where do they get the access of information? Well, they get it actually, a lot of the time, they find it most reliable is from the doctors, but because of the social distancing and the physical distancing, many of them actually do not get access to that. So what do they end up getting? It's actually from their own social medias or from other sources. So risk communication, I believe that this is something that it wasn't talked about much in SARS, but this time more and more people are talking about it. And in fact, the WHO has a subgroup on social science, which devoted entirely to these psychosocial aspects of epidemic. So actually, a lot of people think about risk as very objective, this is a very clear number, but in fact, different people perceive risk differently. So in my opinion, risk is actually both an objective and also a subjective measures, simply because there may be selective exposure, selective retention, selective perception. And most of the time, including myself, people love to just hear and see what they want to see, just to reaffirm their hypothesis. So this is in psychology called the self-fulfilling hypothesis. So which might have influenced some of the different behaviors that you're seeing in different parts of the world, including the US, the UK. And so I think as a public health practitioners, that we can think about that risk is actually both an objective and also subjective measures. So some of the things I want to bring back to is, during the SARS in Hong Kong, we have a SARS expert community communication report. And one of the questions you asked me earlier is that, you asked me before this session is that, well, have we done anything? Have we changed anything such that we are dealing with the epidemic differently this time? And actually, the report was quite detailed, but some of the things that we have changed, one of the things is that I think that we have better communication in terms of having daily press conferences, and there are more working with partnership with the media through regular contact. Although because of the recent social unrest in Hong Kong, this might not have played as good a role, even though these have been done in Hong Kong. So, so the recommendation back then is that there should be multiple modes of communications, conferences, and there should be spokespersons appropriately trained. So this is in fact a big issue nowadays, simply because of our development of our internet and also our social media, And also many of that is communicating and also feeding news to the people they really want to listen to. So the United Nations have made up something that's try to avoid miscommunications and also scams, such that people can stay safe, stay healthy, and stay at home. Now, this is actually not an easy thing to do, and because different countries and different social community will have their own network. So unless you have a lot of resources into investing into it and doing countermeasures for doing fact checking, etc., this is something that might take time and much more difficult to deal with. So another questions that we have is that do people actually have to suffer psychological stress or depression, anxiety, post-traumatic stress disorder, all these things? Is it inevitable outcome when there is something like a big epidemic or pandemic? And some research after SARS has shown that this might not be necessarily to be the case. Some research from the social sciences conducted after the SARS epidemic in Hong Kong showed that the subjective well-being did not necessarily have to be falling despite an epidemic has occurred, including that time that we do have quite a number of deaths in 2003. And in fact, having this external threat to health can build community because people may forget the in-group, out-group discrimination or differences, but concentrated on the same efforts to deal with external threats. So there might be a chance that if you're doing well, if you're holding the community together, you might increase the community connectiveness and also might ensure future security. And in fact, I think a lot of people in Hong Kong have witnessed this occurring after SARS, that people are more together, the healthcare workers tend to support each other during and after the SARS epidemic. And this also occurred in other big significant events, including the 9/11 in New York, which have also a number of papers being published to support that. So even during that time, you may say that, well, what about, some people who are at risk? So people like older adults, they might not necessarily to suffer the most at the end. And in fact, psychologically, some research showing that they might have stronger resilience. So this might help people to look into the different perspective of thinking about that, negative psychological health is or must be one of the outcomes from a threat like what we are having right now. So summary of the intervention strategy, risk perception, and psychological resilience to the COVID-19, I believe that our government and also our community these times have improved significantly since the SARS epidemic. And some people even might quote the term called psychological immunity. So in viral infection, you have vaccination and then you get protected. You have antibodies. I think psychology is similar, that if you get support, if you are dealing with them and you look after these people, then there might be actually immunity afterwards, which might help them in the long-term society cohesiveness may improve. So, and this time I believe there's more transparency in information from authorities, since we are having daily press conference and also much improved websites from our government. Although that I also admit that our community actually have played a very big role in terms of contributing to the very good outcome so far from the epidemic, as there is a high susceptibility of disease and also perceived of high severity of the infection. So accounting for the high prevention measures. So I think the health threat may generate positive influence, and we do not have to take it for sure that it will be negative. So what we do right now actually might affect the outcomes of psychological resilience. If we are building on the social cohesions, that might buffer the threats that we experience right now, and also a focus on a bottom-up approach in terms of community interventions may increase some of the bonding that we might have not have in a very busy city like Hong Kong. So I think we can see this in both a negative way, because that does have some impact on some special populations, including the older adults, including people in quarantine, including some of the people who might not have the access. But we can also look at it in a positive light in terms of building the community, taking this as an opportunity. So, so that is on my slides. Thank you very much.
Right, thank you, Samuel. If I may come back to Gabriel, so just to follow up on your presentation and some questions. Of course, you were 2003. I think you were in the government at the time fighting SARS. So we saw you every day on TV.
That was 2009. 2003, I was still in the university. But yes, I was doing epidemiology again. I was helping government, but yes, I was still in the university.
Right.
After that, in the next pandemic, yes.
See, that impression stick in my head, so I always remember it was you. My apology. But my question is, you have been in the government's cabinet, so you've been there as, as a role in the government. And now you're back to sort of academia into the public health itself. Are there things that have changed since SARS? Have we really learned something that allow us to test better, to trace better, to contain better? And even in terms of longer term, thinking about vaccine, I think today's technology is very different from 17 years ago. In computing powers, in how we learn about genes, human genes, and etc. So what's your view, in that 17 years? Have we learned any lessons?
I mean, I think that the trust, certainly, having made that initial donation to enable the establishment of the Center for Health Protection, brought together the rather disparate parts of the regional offices of the original Department of Health, responsible for the health protection function. So I think that helped a lot in terms of really consolidating the expertise and then nurturing through the field epidemiology training program a lot of the people who are absolute pillars in this particular outbreak. So I'm very sort of heartened to see the direct link between the post-SARS support through philanthropy translated into public health training, consolidation, and then 15 years down the road, now bearing fruit. But I also should hasten to point out that comparison with SARS, other than that, and much more importantly, would be looking at the whole population response in terms of the population behavior, the adherence, the readiness to adopt the sort of SARS mode of operating day-to-day life, and that readiness, which was missing during the earlier part of SARS, but this time very quickly, the whole Hong Kong people really coming together and almost being even ahead of where the official regulatory policies have been. So I think that's really the most important bit. But I would also sort of point out that to compare SARS with COVID-19 is probably not wholly appropriate. Simply, if you just look at the scale alone, Singapore today and yesterday confirmed more COVID-19 cases than Hong Kong and Singapore confirmed SARS cases during the entire outbreak. In 2 days in Singapore, they reported more cases than 2 different big cities in Asia over 4 months. So I think that the scale is orders of magnitude different, and the transmissibility, the spread, the speed, the scope, and really no country is spared this time. It's beyond containment. Containment has failed everywhere. SARS, it was containment, and then driving the virus back into the wild. Over.
Right. So actually, we have a question from the audience. I think you have answered part of it, but I will ask a question because this is a question from Professor Joseph Sung. And if you notice my virtual background, it's actually a calligraphy that he wrote. So I have to ask this question on his behalf. So he said he would like to ask both speakers why the outcome is so different this time between Hong Kong and Singapore. Is it something that we've done right? Is it the government policy, or is it just the Hong Kong people behavior, you know, or are we just being lucky?
Samuel
who wants to take this up?
Actually, if you look at the recent increase of cases in Singapore, you realize that they are actually the cases in migrant workers. So this is actually a very special population within Singapore. That's I was thinking about that they might be one of the vulnerable population that we talked about earlier. So I think in a place like Singapore, where there are a lot of different sectors with different ethnic groups, there might be a more complicated approach needed in order to disseminate and also communicate with the risk associated with COVID-19. So, I think we need to look into the cases which is responsible for the majority of the increase of cases in Singapore to understand this. Now in Hong Kong, I think we do have some migrant workers, but the population might be different in terms of the distribution and also the components. And all that may account for the differences in terms of the control between the two places. And in fact, just the Singapore right now is that they are planning to test for everyone, and they're going to these quarters where these people are staying in order to understand and to know the extent of the infection. And in fact, many of these people have very mild symptoms. And I think only one of them was in ICU. So this different aspects of looking after everyone in the population. And because sometimes we might miss a certain sector, which might cause the infection, simply because this time the transmissibility, as Professor Leung has said, is so much higher compared to SARS. So if there's even a single case, might result in a large outbreak. This is my thinking.
Right. I think Samuel brought up a very interesting point, which we also discussed, I think, even before this session. I think I asked the question, Hong Kong, in fact, has the largest population of elderly people living in residential homes, right? 7%. It's the highest in the world. But you see Italy, you see Spain having outbreak in those residential homes. I guess, fortunately, we haven't seen that in Hong Kong. Similarly, now Singapore, we're seeing, you know, like Samuel described, the migrant workers. But Hong Kong also, the living condition is very, very jammed. You know, you have subdivided housings, you have some of these public housing projects. But then we kind of, at least so far, escaped that outbreak in the community. So I guess, you know, just add to the Hong Kong-Singapore comparison question. I wonder if Gabriel has any view on that.
I mean, I think that you need to understand the Singaporean outbreak to sort of say, look, the dormitories are obviously a very high risk super spreading event waiting to happen. So we saw it during SARS, we saw it during COVID-19, and we saw it on the cruise liners. We saw it in prisons, in 2 prisons in mainland China during the mainland Chinese first wave outbreak. And now we see it in Singapore. So it is something that one should really be expecting. The prison population, of course, is another very important setting. I was just talking to the Chilean health minister this morning, and he told me that they are testing everybody in prisons in their country. So I think that, you know, institutional settings is really sort of something we need to really watch out for. Secondly, is if you just take away all of the dormitory outbreaks of the migrant workers in Singapore, you still see actually a fundamental difference between Hong Kong and Singapore, as Joseph has very astutely pointed out in his question. If you actually look at just the 10% of the cases which are non-dormitory related, they're all, first of all, locally acquired, and about 1/2 to 2/3 are so-called unlinked cases. That is, you couldn't find the index, who actually infected them in the first place, which tells you that there is actually a reservoir of mostly silent infections going on. And you see roughly around 15, 20 to 25 every day in a population of 5.5 million. Now, if you sort of just pro rata scale it to the Hong Kong context, we are really sort of 50% larger than them. So if you actually scale that, we would be looking at 30 to 50 of local cases in Hong Kong. Now, that's really at the height of our outbreak so far, since middle of January. And so even without the dormitories, you are seeing what Hong Kong's sort of height has been so far. So I think that it may be something to do with them not having closed schools up until 10 days ago. It may have something to do with the relatively more relaxed policy of face mask recommendation. It may have something to do with them not really taking the physical distancing measures quite as stringently or as early as we've done. It could be just bad luck. I would just like to sort of conclude and say, this is a marathon. We have just gone beyond probably 200 meters. And I never like to tempt fate, because if you think that you have already done well and have already succeeded, especially over others, I think that one is bound to have Murphy's Law descend upon Hong Kong, and that's never good. We're in a very, very long marathon. And I think that really we need to be in solidarity with our Singaporean friends, and actually particularly the low and middle income countries, who will suffer one of the gravest health inequities in our time by omission. That is, if the richer, more able and more advantaged countries and cities don't come together and help them through it, because it is that sense of solidarity, not only for humanitarian reasons, but also for selfish reasons, that it will all come back to the rest of us. Over.
Yeah, I think Gabriel talked about marathon because he knew that I'm a marathon runner. So I guess my own experience in marathon running, partly is you train your muscles and stamina, but partly is very much in the mental side. So Samuel talked about, potentially this crisis, in fact, would bring even more resilience or bring the community together. My question is, in marathon running, we know, there is some part about training your muscles. There's also part about training your mental, because it is, a pretty long hours on the road by your own. So on this side, Samuel, I wonder if you would share any insight on, how the community can actually build these mental muscles, during or post-crisis, or like Gabriel said, if we'll be in this for a prolonged period of time, would the resilience go away? Would people fall more into despair? Is there anything we can do?
I think from the community side, I think more empowerment is needed for them to build the resilience and also provide the positive resources for them. And one of the things that has been shown to work in terms of mental health interventions, not at the community level, but at the individual level, is in fact what you have been doing for a long time, exercise. If you're thinking about the training of muscles will be for improved physical health, the training of the brain can be done by various ways. One of them is exercise, physical activities. And the other thing is of course other methods, including some of the things that I research in, including like mindfulness meditation. Also, doing altruistic acts, in fact, can improve one's mental health. So from the community level, I think that providing resources and approach which can increase the resilience and altruism and improve the community engagement is something that might help. And so, but then you can ask, you know, what kind of engagement you're talking about. I think something that actually can have a sort of evidence-based intervention for improving mental health and well-being. So using this, intervention, but involved in a community level together.
Right. Yeah, I have an example that I can share. I mean, we the Charities Trust supported an initiative back in 2018. So it's a platform called Open Up. It's basically a 24/7 kind of platform on social media for young people in particular, that they can, you know, through the platform, have a counselor or a volunteer chat with them. So we have served hundreds of thousands of cases in the last, you know, about year and a half. But in particular, in the last 2 months, the traffic really increased. In March, the traffic increased from average, a 30% jump from the average. And the number one sort of being quoted still is about emotion, family. But then the COVID-19 situation is now right there, top on the chart. So people are disturbed and people do want to talk about it. So I guess in some sense, even some technology can help build those resilience and social muscles and all that. But I think there's other areas we still see challenge. For example, we are talking to a lot of the social services that are into family relationships. So one thing reported, at least anecdotally from a lot of them, is that they are seeing an increase of domestic violence, you know, family violence. They are seeing cases, couples having, you know, trouble living with each other, you know, under the current situation. So I wonder, again, sort of from sort of a public health perspective, from your research into psychosocial emotions, are there anything that we could already sort of start doing to help address some of these challenge that we'll be facing?
I think from, if you talk about domestic violence, I think some countries do have some hotline for them. The problem within, I think within our culture is that people might not be willing to access this hotline, although there's good evidence to show that they might work for these people. So I think one of the ways that we can do is to connect some of these people and building their own support groups, such that they will find that they are facing the same issues, such that they can support each other through this hard time. And in fact, there's some survey done, I think, in the UK showing that COVID-19, actually, a lot of people have fear, but they're more fear about how to die. They're worried about if they're being socially isolated and they got, because of COVID-19, they will be dying without people around them. So I think the issues is more complicated than just having people not getting the disease, but actually people more worry about how they are being treated when they get the disease. Whether they can be treated with humanity, whether they can be treated with respect, dignity, etc., or whether they will be just a case. You know, we talk about COVID cases, that there are these people, and some of the literature on the quarantine showing that they do predict post-traumatic stress disorder for people being quarantined. And one of the ways to prevent that from happening is actually giving a hotline to them, to give them information, and also provided them with enough resources, you know, in terms of the public health information, in terms of the resources they need, even daily supplies. Those sort of things that we think is quite minor, actually can predict a lot of these outcomes of how people feeling being treated. So I guess the humanitarian approach is needed when you have such a stringent public health measures from people, and some of the evidence showing that if people are doing voluntarily being quarantined, actually they will do better in terms of the long-term health outcomes, mental health outcomes, compared to people who are forced to be quarantined. because they feel like they're being contributing to the society by doing some self-sacrifice. So they find meaning in doing that. Yeah.
Interesting. Yeah. Now, I think one thing we all probably notice and observe is that some of the behaviors and some of the ways that we approach things would probably be forever changed, right? I mean, work from home arrangements, more digital platforms, even some human behaviors, I guess potentially would be forever changed. And I think how government also reacting to crisis, I think these would be considered very, very differently going forward. So I guess we spent a lot of time talking about sort of the current situation, how we got to where we are. I like to switch the topic a little bit sort of into more futuristic. I think, Gabriel, you wrote an article in New York Times, which I faithfully read every single word. I found it's very interesting. You are thinking about exit strategy. You're talking about the switch on and switch off. I used to run operations. I understand, when you switch on and switch off an operation, it's actually very challenging. Usually things and people carry a certain momentum, right? So what's your view? How do you think about, when you talk about the exit strategy? And for the benefit of the audience, don't know if everybody reads your article. Perhaps you can also explain a little bit what you meant by sort of exiting in what kind of time frame.
So basically, the epidemiology tells us that you probably need at least half the world's population to have immunity before this is going to settle down. Settle down, probably not completely fading out, but probably turning into a seasonal endemic infection, just like the other 4 human coronaviruses. And how can you reach immunity? There are only 2 ways. One is natural infection and recovery, and the second is through vaccination. Now, vaccine is going to take us at the earliest 9 months, and it could be 1.5 years, 2 years. So that really means that we are looking at least a couple of waves, maybe even 3 waves, before we will have a safe and efficacious and widely accessible vaccine. And so we're looking really at a series of suppression and lift cycles, where as the force of infection in the community rises, and that is reflected through the real-time reproductive number, the RT, you would anticipate that rise and try and interrupt it by really applying many of the physical distancing measures, and to the extreme, they would be called a lockdown. And that's the kind of suppression strategy you would be talking about. And although Hong Kong hasn't gone into a lockdown, obviously, but we have applied a lot of physical distancing measures that we would not consider under any normal circumstances. And this, while it protects health and protects the integrity of the healthcare system at the acute care level, it is at the detriment, or to the detriment, of economic preservation in terms of GDP and employment. We haven't seen such bad figures for a long time now. And then in terms of social acceptance and compliance and emotional well-being. I was reading some of the questions, scanning some of the questions, and quite a few sort of go to not just sort of the psychological health or the mental illness range, which Samuel very kindly summarized for us, but also about teenagers now getting very used to the virtual world and parents worrying that they may not actually come out of it at the end of all this. So the 3-way tug of war is going to be forever at loggerheads or in tension with each other until we reach that stage of a vaccine, or when more than 50% have had infection and recovered. And so you probably need to look at that lifting when you are at very, very low levels, And in fact, another question posed by the chairman of the UGC, Carlson Tong, said, look, when can we get out of this? I rather suspect it's probably to his other hat in the financial sector that is asking that question. You know, can we do with some form of normality, albeit maybe we still need a few physical distancing rules in place, but probably not the whole package, he hopes, until a vaccine becomes available. So I think that that's the kind of thing you need to be looking at, and any sensible society would be looking at that. And indeed, you are already seeing or have seen several weeks of the lifting of those measures in mainland China. And you are hearing that places like New Zealand are going to be lifting as some places in Europe and maybe even in America prematurely soon in the next couple of weeks. Over.
Right. So, I mean, again, that just posed a very interesting question, I think, also to Samuel, right? I mean, obviously, the future is uncertain. So we potentially will be seeing sort of lifting, but then reimposing, lifting, reimposing few times, hopefully not many, many times. But that is a source in itself for emotional swing, for people's anxieties, for, you know, do I go to work tomorrow? And then next week I don't go to work, the next week I go to work. So Samuel, from your research or from your perspective, if we are entering a phase like that going forward, let's say in the next 6 to 9 months, what do you expect sort of the impact on psychosocial? And then are there any things that we could do to mitigate that kind of uncertainty?
To be honest with you, I think it's hard to predict because different places will have a different makeup of members of the society, and they will have different social capital and social cohesion. So I think how it comes out will be a predictor of various factors, including what was the community engagement like or cohesion like before the epidemic occurs. And also there will be, in terms of the risk factor, including people with persisting mental illness, the number of people who've gone through isolation, those sort of things, which will be the predictors. In terms of, I think your second question is what can we do? I think one of the things is, I think one of the things that we need to communicate with the public is that that we should increase the transparency and explain the reasons why actions are done through various channels, and not just from one particular source. Simply because of the fact that now we are living in a world where people will only listen and access the channels that they're most comfortable with. So I think in terms of the engagement, we should also engage with community leaders, but also people like influencer, like KOL, key opinion leaders, etc., which depends on your age. You might be quite unfamiliar with. So these are the things that I think we can use different community channels in order to gain the trust. Because after all, it's the trust that matters. After all, is whether people trust you. And so if they trust you, even there's uncertainty, they know that, you know, you are there to support them and give them the accurate information, then they can still, you know, be well to going through that, and they will have the least negative outcomes out of the epidemic, I think. So a lot of these are communication strategies and also the engagement with the community, I think.
Right. So I guess 17 years ago, SARS happened, and then afterwards, you know, the whole community come together. I think government also talked to different sectors. The Hong Kong Jockey Club Charities Trust also had the honor at that time to donate 500 million Hong Kong dollar to partner with the government, like Gabriel mentioned earlier, to set up the Center for Health Protection, which is obviously very critical, a very critical component today in fighting today's infectious diseases. So I don't know from, I guess my question is from your perspective, what else needs to be done? So going forward with this uncertainty, obviously everybody's effort will be today or in the next few months fighting this COVID-19. But after that, are there any more things that we could do to help build system resilience or technology advancement? Are there anything we can further do to strengthen the whole public health sector from different players? So I don't know, Gabriel, if you were now back in the government, what would you do next?
Well, I'm not back in government, but there has been some recent movements in government I learned from the news today. But what I would say is, I think that COVID-19 is going to take us a little while longer to really get over. And then I would anticipate there'll be the usual commissions, the inquiries, and the reviews. And those are going to take some time, and they will come up with recommendations and follow-up, although I hope that there will not be recriminations, certainly not in a toxic sense of that word. But I think that the world will be very different post-COVID-19 compared to where we came off at the beginning of the year. And I think that it really goes beyond just public health. I think that you're going to see this rather divided world either split further with deep, deep chasms, or you're going to see the beginning of the mending of those deep scars which predate COVID-19. And the reason I say that is because perhaps even despite our best hopes, aspirations, and efforts, we will see the number of deaths, fatalities, serious illness, and number of cases track quite closely with good governance, material means, robust health systems, and sensible politicians. And when you have that as a final outcome, you will then see a lot of room to repair those deep scars that we will have left behind a year or two hence. So I think that really we're seeing a lot of the tectonic plates which had been sort of already trying to glide over one another completely disrupt the entire world, both in terms of geopolitics, national politics, the whole concept of disparities, but also in the economic and business side of things, what politicians, however powerful they are and whoever they may be, cannot do, that is totally disrupt and yank apart global supply chains. COVID-19 did it within 3 months. And so I think that it's going to be a very, very different world. And it really calls for reflections that should be much, much, much deeper than when we had 2009 swine pandemic, certainly more deep than after SARS, and likely it would be something akin to post-Great Depression or even post-World War II. I think that it's really as serious and as deep as that. Over.
I think I can echo to that as well. You know, generally with the charities trust, you know, I think sometimes people also complain about the grant-making process being sometimes can be a long due diligence process. So it took a long time, but it took the COVID-19 to really substantially change that. Of course, the challenge to me now is what we can do now. Can we even, you know, make the process even more efficient post COVID-19 going forward? So I think that to us, some of the lessons that we learn, and also looking into the future, to think about how we use this. You know, I know it's bad to say that right now, but then how do we use COVID-19, but then to create opportunities for improvement? You know, I think today we have all globally, I think, experienced work from home, globally experiencing learning from home. So there is a lot of work that we could do to improve the content, improve the curriculum, make it a lot more interactive, make it really work, you know, not as a sort of a plan B, but even as part of the plan A, even when school reopens. So can we think longer term, about that? Of course, short term, a lot of the NGOs, nonprofits, they need to be able to survive through this storm. So I guess to the community side, foundation side, or the government side, I think we all need to put our heads together and think of even short-term relief to help so that some of the essential services can be maintained longer term. I think if we think even longer term, then I would say, I agree with both speakers. Earlier we said, what are the institutions or infrastructures we need to start thinking? And again, with sort of, today's technology, what can we further build? Like Gabriel mentioned, how can we trace things even better? Right? I understand in Hong Kong, for example, there was a point they used the police supercomputer to trace some of the case here. But can we even just have a supercomputer in CHP so that in the future it can be traced already? With the development in AI, with the development in big data analysis, how can we, even then use this opportunity to invest even bigger and more aggressively into technology side? I think similarly for mental wellness and for community resilience, I think there's a lot still for us to learn, through what solid measures we can build up the strength in the community bit by bit. These sort of things, it doesn't happen overnight, but obviously for us, there's a lot of questions for us to ponder. So I think with that, perhaps I open the floor for any questions, although of course there are already some questions come in. If I may, we have a guest maybe from Sweden. So if you don't mind, perhaps I would ask this question on his behalf, Robert. So this is a question he mentioned for Professor Leung, for Gabriel. So he said, how can you relate Sweden's response to COVID to responses of other Western societies? Right? Sweden didn't engage in a lockdown, but remained open with social distancing. The result indicate that the same infection rates and trends were the same as societies that engaged in a lockdown. Can you discuss?
Well, I think that, look, it's not easy to try and do a tally in the middle of a pandemic because we don't know whether we are done with it yet. And the likelihood is we're still not done with it. So I would sort of say, comparing Sweden with Austria, the total number of cases is very similar, just under 15,000. But Austria has got fewer than 500 deaths. Sweden has got 1,800, give or take, deaths, which tells me that because deaths ascertainment is probably much better than case ascertainment. And if you sort of take a case fatality ratio of roughly 1 to 2%, that means that you add a couple of zeros and multiply by 2. That really sort of gives you the true infection, or at least symptomatic number of cases. And that is not a small number. So I wouldn't say that they are really very similar across the rest of Europe, which have implemented much tougher physical distancing measures. I think the jury is still out. I think that the day to answer these questions, I was just sort of saying the same thing to an FT journalist earlier this afternoon. I think that there is a time and a place for everything, including looking at the relative so-called success of different countries and different places within countries. And that is after all is said and done, not in the middle of the outbreak, because we are actually quite uncertain about what is happening. And secondly, I think that the population density of Sweden and say Paris or London, even comparing apples with apples, if you look at Stockholm versus London and Paris, I think it's a very different kind of density and population mixing pattern. So I'm not sure that it's a fair comparison, but yes, I will acknowledge that Sweden has chosen a rather different path from even their Nordic neighbors. And I think that, you know, the so-called judgment day will come in about a year's time when hopefully most of this is settled. Over.
Right. So there are a couple of questions about the younger generation. I guess one is must be from a parent. I think she was asking, we mentioned there are a lot of returning students from Europe, from America. When can we expect that they will go back to school in Europe and in America? So I think that's question one. Question two is also about, this particular age group. I guess in the last year, since summer 2019, Hong Kong has seen two crises, and both probably also hit quite hard on some of the younger generation, when they think about their school, when they think about graduating, when they think about jobs in the future. So I guess the question is maybe more so for Samuel, is that, are there any study that would take this particular age group and really then monitor their life and see whether, these crises have any significant impact on their journey. So I guess maybe question one for Gabriel, when can these students return to school in Europe or North America? And then second question for Samuel.
I think about school closures. So nobody really knows what is the effect of the school closures yet. And I think that any sort of conclusion is premature and tentative. But it appears that from some of the research that we are just wrapping up, that susceptibility by age is differential. That is, younger people probably have lower susceptibility. That is, that they are less susceptible to be infected. And if and when they're infected, they're less likely to show serious symptoms. I think this much we are tentatively quite comfortable with. Now, whether being less susceptible and less seriously ill translate into being less infectious, that is, as an infector, and spreading the disease around, I don't know, but logic would tell you probably they would be less infectious, although we're not sure because there's so few of them that we detect. So it's very difficult to gather the necessary data. Now, if you believe in that logic, less susceptible, less serious illness, and maybe also less infective, then probably you could say, out of all the physical distancing measures, maybe given this, it is not that unsafe to reopen schools and restart classes, given that they also are very socially disruptive, not only for the children and young people concerned, but also for the childcare, especially for primary school and kindergarten children, that imposes on parents and by extension, the real economy. So I think that, that is something that we need to be looking at quite seriously and quite soon. We hope to be wrapping up some of this research soon, but I think that what one should not expect is to say, if government give the reopening order for schools, it is risk-free. There's nothing that is risk-free. The only risk-free solution is a complete lockdown until a 100% safe and effective vaccine. That day will never come. Even vaccines that are marketable and marketed will carry side effects. So I think that we don't live in a risk-free world. It is always about minimizing bad risks and trying to balance different kinds of risks, whether it's health, whether it's economy, whether it's livelihood, whether it's mental well-being. Over.
Yeah, thank you. And Samuel, what's any study or any plan to research this particular age group, the younger generations?
Yeah, I think we need to understand this this age group is that there's something that is occurred over the last 1 to 2 decades, is that the onset of having clinically relevant psychiatric diseases like depression and anxiety disorders have been younger and younger over the years. So meaning that people are getting depressions or anxiety disorders at a younger age, which can predict their lifetime course of having depression again and again. So each age is a very sensitive period, is very critical. And whether someone would develop a long-term psychological problems depends on various factors. Some of that including the genetics, and also some of them depends on whether they receive the adequate social support that can moderate the adverse events that happen. So it is never an absolute trajectory from a life course perspective. It is always interactions of various factors giving the individual vulnerability. So I think so when we're seeing this large social unrest or large threat that is happening to the whole populations, I think what we can do really is to think about what measures can be done to reduce the occurrence of having clinical conditions. So there are other moderating factors which might work, including I talk about social factors and also engagement with them, such that they would not increase the risk of having a recurrent disorder throughout their lifetime.
Right. Yeah. Thank you. Well, there's a question from Aruba. I think it's quite similar to what the speakers have addressed. But anyway, I will read that out and see if any speakers would like to add to it. So the question is, as an island heavily dependent on tourism from the USA, and also an open society with citizens in constant interaction with USA and Europe, is there a sensible way for islands like ours to have open skies anytime soon, or in a post-COVID pandemic era?
Well, let me try. I think that, being an aviation hub, I mean, you can just replace Aruba with Hong Kong. It's also equally applicable. So I think that, first of all, aviation or tourism is never unilateral. It's at least bilateral, but practically it's multilateral. So it doesn't really matter what you do, especially if you're from a small place. It really depends on what all your neighbors and all your contacts do. And so I think that this is where sort of the global coordination is needed, whether it's through WHO or IATA or OAG. It has to be coordinated at the global level. Secondly, I think that there are ways of trying to minimize risk. Whether they are practical or feasible is a different matter. So, for example, there are calls and recommendations to say, look, at least for occupational safety and health reasons, you should be testing PCR for all crew members, including pilots and cabin crew, on a weekly basis. That probably will sort of try to screen out anybody who's possibly infectious in terms of the staff. Then, as I suppose, if you want to be fairly certain that it's safe to be on board and at airports, you could do the same for all the passengers. Now, whether that kind of volume you have the test reagents for, and whether it's feasible and economical to do so, is a different matter. So the science has a way, but whether the operations logistics and the economic trade-offs is strongly warranted enough is a matter of trade-off. And I think finally, I think that because the global epidemics that make up collectively the pandemic are not synchronous, it is going to be a very tricky act of global coordination to restart the aviation and tourism industries while trying to keep safe and complying with border restrictions. So I think that this is one of the trickiest questions that the whole world faces, but I think that it will be up to a few major aviation hubs and the major airline chains, and there are 3 or 4, to sort out over the next month or two. Over.
Right. Yeah, thank you. There are still questions coming in, but we're going to run out of time. I think as the host, if the audience don't mind, I would try to take the last opportunity to ask a question. But of course, there are still questions on globalizations and urbanization, how COVID-19 potentially may forever change the trajectory, of urbanization and globalization. I think that would probably take a separate webinar to address. So if I may, my last question for both speakers is how can you help me do my job well? 17 years ago, after SARS, the Jockey Club Charity Trust, we make a donation of 500 million to build CHP. So this time around, if we were to do a donation to that similar scale and try to really make a difference, and an impactful difference for the community, what would your advice be? What is the one thing that you would say, yes, we should have this?
You're saying one thing, right?
One thing.
I think there are several things.
Okay. Go ahead. You could try me.
I think I was more thinking about I know that the trust has been doing a lot on the vulnerable populations, right? But I think without accurate data and without accurate intelligence of the extent of the people with difficulty using some of the online platforms, etc., it is very hard to understand and to help these people. In primary care settings, I see people who are staying at home and who look after the children, but they have no internet access. They have no computers. And sometimes I wonder if these people may be very hard to find and reach them. So I think we need a better platform to get the accurate information in order to help these vulnerable populations. And with the some of the social inequality we have, I think we need a more systematic way of looking at these problems. As I believe that even though we have a lot of NGOs, still there will be population which is hard to reach, and these may be the important population that we also should look after in order to improve the population health. Because during the epidemic like what we're having, even one person, if we don't look after them well, they might result in affecting the whole population. So I think the approach is important. The other thing is, I wonder if there's we can do more community engagement from more of a bottom-up approach in terms of using better communication channels. We tend to use more traditional one, and because some of the channels are very hard to access, and it's take much more time to develop. So I think we need to take a more investment in terms of the community engagement during this crisis from the more psychological perspective. Yeah. Right.
Okay. Great. Thank you. So data-informed strategy, and then community engagement in a big scale.
Yeah.
Right. Gabriel?
Just one word: solidarity. How do we redefine solidarity beyond the traditional collectivism, which is been tried, but that clearly hasn't worked, either locally or globally? What is a redefinition and a recasting of solidarity where we have that functionality, but perhaps without the need to strip individuality into a collective? How can we rediscover a new sense of solidarity? That to me is really the most important thing. Over.
Wow. We're getting very philosophical here. So we still have 2 minutes left. Actually, beforehand, some NGO leaders asked me to relay this question if there is time. Listening in tonight, there is a lot of leaders from different walks of life, NGO leaders, educations, and what have you. What's your one piece of advice in terms of leadership for a lot of us trying to not just ourselves going through the crisis with our families, but with a team, with stakeholders' expectations, what is the one piece of advice you would have on leadership?
Shall I go first?
Please, Gabriel.
Leadership, I think, understated leadership by role modeling and patient tilling very, very close to the ground. I think that is what most people aspire to, but many of us fail to act out. I think that kind of leadership of really being very close to the ground and working amongst peers, that kind of leadership is probably what will work best as we go forward from this point on. Over.
Yeah, thank you. Samuel?
I think we know that transparency actually works quite well in terms of building relationship and communication. So you asked the leadership in terms of quality, we need to be honest and be true to what we do, which is easier to say, but sometimes often because of so many priorities, sometimes it might not be the thing that the people might take, because it's expose your vulnerability in a sense. So I think dealing with the population is no different from dealing with as an individuals. If transparency helps with trust, then showing yourself and telling people what your values are and being honest also help to build trust among the colleagues and people working for you. And of course, if from a more objective management perspective, I think we need a balancing of things that we need to do, and also at the same time showing that we are emotional beings, and we do have our humanity side, such that it's a balancing and act and such that people will feel driven to work for some important values that is important to them. So
right, great, thank you. Be grounded, transparent. I would just add, also courageous. Have the courage to pursue what you believe. So tonight, once again, thank you very much for both speakers and for the audience who dialed in at this hour. I won't try to summarize the whole session, 1.5 hours. There are too many things, great points to summarize. But I believe every one of us enjoyed this great conversation. So once again, thank you, Professor Gabriel Leung, and thank you, Professor Samuel Wong.
Thank you.
So that concludes the SDSN webinar on COVID-19. Thank you very much for joining.
Thank you.
All right, bye-bye.
Bye-bye.